In 2013, Nevada doctors aged 65 and over made up 26% of the practicing workforce. Those aged 55 to 64 made up another 20%. With nearly half of Nevada's doctors near retirement age, we face the problem of not having a trained physician workforce large enough to meet the demands of the growing healthcare marketplace. In fact, a recent study by the American Medical Association found that, as a nation, we could be facing a shortage of up to 100,000 doctors in less than 10 years. In Nevada, there were only 63 actively practicing primary care physicians for every 100,000 people in 2014. This ranks Nevada second to last. But it's important to take a step back and look at the growing trends in medical education around the country. The federal government currently spends roughly $15 billion annually to train physicians in this country. These funds are used for graduate medical education to train residents. 78% of this funding is provided through Medicare. Before 1996, graduate medical education programs were granted through Medicare-funded residency slots as long as they could certify that they would be filled. But in 1996, as costs of this program were ballooning out of control, Congress passed and President Clinton signed into law a cap preventing any new allocation of graduate medical education slots. So opportunities for graduate medical education today are distributed based on what states wanted in 1996, not what they needed in 2016. Making matters worse, some of these states don't even have the students to fill these slots. In 2011, there were over 1,000 Medicare-funded graduate medical education positions allocated that were never filled. This whole discussion is important in the overall picture of addressing the physician shortage because studies show that the states where medical residents get their training stay to practice medicine. But the problem lays with unused graduate medical education funded slots. Why shouldn't these slots be used in another state? The top 5 states that receive these slots also receive nearly half of federal funding for graduate medical education students. The top state, New York, receives more federal graduate medical education funding than 31 other states combined. So after meeting with Southern Nevada health professionals who run the graduate medical education program in Las Vegas, and after learning more about this program, Congressman Hardy introduced the Graduate Opportunities in Medical Education Distribution Act, GOMED for short. GOMED would implement a program to redistribute unused Medicare graduate medical education cap allotments to states feeling the worst effects of this physician shortage on a 5-year rolling basis. It's widely accepted that where medical residents learn, they stay to practice, and 77% of medical residents who learn in Nevada stay in Nevada. But in 2014, Medicare only paid for 137 residency slots in the state. By comparison, the top 25 states receiving this funding averaged over 3,000 graduate medical education slots each. Because of this outdated system created in 1996, we don't have opportunities for medical students to stay in Nevada. The Reno Gazette-Journal highlighted the lack of opportunity for graduate medical education back in 2014. A regent at University of Nevada, Reno said that of graduate medical education students, we teach them to leave. Considering 77% of graduate medical education students in Nevada stay to practice medicine in the Silver State, we need to do more to create opportunities in Nevada and elsewhere in the country. If we're serious about creating opportunities for more doctors to be trained and increase access to health care, then this bill would be a step in the right direction.